Big warm welcome to Craig Mullen today. We're very excited to have him on Optimal Metabolism. We're going to be talking about topics that everybody wants to hear about today. So deeply diving into metabolic health, we'll talk about some peptides and how you're using those, and some other therapies and approaches that you're using that maybe not a lot of practitioners are talking about. So if you could go ahead and introduce yourself, give us a little bit about your backstory and how you got so interested in what you're doing today, that would give the listeners a little bit of, education about what we're going to be talking about.
Of course. So pleasure to be here today. And thank you so much for having me on the podcast. I'm delighted to be here, and it's going to be a great conversation. So my name is Craig Mullen. I'm a nurse practitioner. I've been a nurse practitioner for nearly a decade now. My training is family as well as acute care nurse practitioner. So my background for the past handful of years has been in hospital medicine, but also have been doing a lot of trainings and research into functional integrative care to really improve health span and help people live their most vital, rejuvenated existence as much as possible. And so I'm about a year and a half now into my practice, which is Remedy Functional Health Solutions here in Salisbury. And that's what we're about. We're about improving overall wellness, overall health, really by looking at the cellular mechanisms that drive energy metabolism, that drive continued insulin sensitivity in the body, so that our all of the cellular processes that allow us to remain energized and productive are working at their optimal.
Yeah. And we're seeing that more and more. Like, people want to look at different organ systems and kind of piece the body apart and be like, oh, my heart is not functioning. Oh, my digestion is off, or my pancreas isn't working well. But really, it's really just going to that cellular level. And if your cells are not healthy, your mitochondria aren't healthy, you are not going to be healthy. And insulin resistance is one of those things. Like, it affects every single organ system and every single cell in the body. So we talk a lot about insulin resistance on this podcast, and a lot of the listeners are struggling with metabolic health in one way, shape, or form, like the vast majority of us.
Sure.
But we know that we've talked a lot about testing our blood sugar and a hemoglobin A1C and our lipid panels. And we've talked a lot about fasting insulin also, because I think that's becoming better known that fasting insulin, like elevated fasting insulin, usually precedes fasting elevated blood sugars. And that can be for years to decades to come. But are there any other like functional tests or markers that you're using with your patients that are really telltale? Like, okay, your blood sugar might come back normal, your lipids might even be looking pretty good, but there are other markers that might be screaming like there's something going on. And I think it can be very, very almost traumatic for patients to go in and they've just felt like crap for so long, and they go in and they get their labs tested. And you and I know that by the time the labs are off, you're like been sick for a really long time, but they feel so dejected because they're like, oh, my labs are normal, I don't know what's going on. But what are some other things we can look at that you're using in your practice that might key us into what's going on metabolically?
Yeah, sure. So, as a general sort of assessment as to whether there's inflammation at play in the body, I'm always doing a C-reactive protein assessment. High sensitivity C-reactive protein is relatively non-specific, but it does show that there's inflammatory burden in the body, which is absolutely going to be exacerbated by things like insulin resistance. So if I see that, CRP is elevated, and I'm seeing that, somebody's insulin is starting to elevate and their HOMA-IR score is not within a desirable range, then, these are people who are really high risk metabolic patients, and they're going to have high degrees of lipid peroxidation, and basically, the changes that make atherosclerosis happen, and plaque development in the arteries, and changes to nervous tissue, and so on and so forth. So always looking at a C-reactive protein, looking at oftentimes other indicators for vascular inflammations such as homocysteine, which of course can be elevated for various reasons. Sometimes it's genetic, sometimes it's it's metabolic, and how different amino acids are broken down and transformed. So if homocysteine is elevated, for example, above 10, I'm always looking to lower that, relatively precipitously, just to really try to lower some of the vascular inflammation that person may be dealing with. And then certainly some other markers. We hear about lipoprotein little a, which is a genetically driven marker associated with increased potential to develop plaque in our arteries. So that's, something that historically we have felt, okay, well, it's genetically driven. It's not something that we can really modify with lifestyle, such as diet and exercise. But there are some medications that are actually in the pipeline right now. Things like niacin have shown some potential in lowering lipoprotein little a. Myeloperoxidase, another marker for lipid peroxidation or cardiovascular risks. So depending upon the patient, we have to meet them where they are, and everybody's unique. Everybody's physiology deserves a little bit of a different workup. So it's really fine tuning that assessment to what the patient is displaying from their medical history, from what their previous labs show, and what their actual complaints are.
Yeah, and it can be frustrating to get an elevated CRP because, like you said, it's like, oh, maybe it comes back at 10. And I know I like to see it like for 1,
Yeah.
honestly. And like, there's some inflammation there, but you don't know where. Like but at least it backs you up, and it backs up the symptom. Like, okay, I'm having these symptoms. I don't feel great, but I know there's some inflammatory processes going on in the body for sure. Well, let's talk about peptides because this is a very hot topic, and GLP-1 are classified as peptides. We'll talk about those in a minute. But what are some other peptide therapies that you are using in your practice, and what are you seeing as far as outcomes for those? That people might not be aware about. Like, I know that specifically there's some like digestive peptides that can be really helpful for folks with digestive insufficiency or, chronic bowel or digestive issues. But walk us through some of those, because everybody's so honed in on GLP-1, but it's not the only peptide out there.
Sure, absolutely. So, GLP-1s are great. They've received a lot of notoriety and attention over the past few years for their efficacy and in weight loss. And just as they are incredibly effective for promoting some fat loss, promoting insulin sensitivity, there's several other peptides that are also metabolically, major players. And if we think about, the gastrointestinal tract, we can talk about peptides like BPC 157, which of course, a lot of people are hearing about now. It's usually the one that people come and ask me about first outside of GLPs. And this is a 15 amino acid sequence that is found naturally in human gastric juice, and it has a number of different activities in the body. And so, it helps to reduce inflammation throughout the gastrointestinal tract. It helps to improve nitric oxide synthesis throughout the body. So we're improving blood flow, which is of course associated with nutrient delivery to tissues, but also, nutrient absorption, right? So it helps in that regard. It also helps to, down-regulate inflammatory players within the gastrointestinal tract, which can ultimately reduce the risk for some of the autoimmune and chronic inflammatory changes that we associate with things like leaky gut and dysbiosis and things of that nature. I often pair BPC 157 with KPV. This is an excellent, again, anti-inflammatory immunomodulatory peptide that helps to restore balance throughout the gastrointestinal tract. And these two in combination with each other, in combination with GLP-1s, they can be absolute powerhouses for helping to improve gastrointestinal health in individuals who are suffering from IBS-C, which is, IBS with a constipation variant, or IBS-D, and even inflammatory bowel diseases such as Crohn's or ulcerative colitis.
Mm-hmm.
So those are, those are some key peptides that I use from a gastrointestinal standpoint. Thymosin alpha-1 is another. This is, an immunomodulatory peptide. It's produced by the thymus gland, which is an immune gland that sort of, becomes less active as we age. And as that happens, we have increased risk for infection, increased risk to develop some autoimmune changes in the body. And so by helping to restore some immune balance, we can really positively influence the gut in that way as well. Right now, I'm really big on the mitochondrial peptides. So SS31, for example, was just at the end of September, FDA approved as Forcinity. And this is, it's been granted FDA approval for the treatment of Barth syndrome, which is a mitochondrial disorder. But it has wide-ranging applications, anything from, post-viral, long COVID type syndromes to chronic fatigue and cardiomyopathies, all sorts of, wonderful applications. So I've found that to be one of the most effective peptides in my client base. I see its benefit in patients who are suffering from autoimmunity, brain fog, poor energy, low fatigue, high fatigue. Maybe they're stuck in more of like a glycolytic metabolism state where they're not really going through the full process of energy generation, and they're feeling very low energy on a chronic basis as a result of that. So basically SS31, what that does is it's a cardiolipin stabilizer. Cardiolipin is basically provides the scaffolding on which the proteins that are involved in mitochondrial energy generation are housed. And so if you think about, a scaffolding that would be used to help create a building, if that scaffolding is weak, if it's falling apart, if it's in disrepair, that building is ultimately going to pay the price for that. And so our mitochondria need to be robust in their structure and in their health. And if that scaffolding, the cardiolipin is degrading, then that energy metabolism, that energy generation potential is going to be degraded as well in the mitochondria. And so that is the main focus of SS31. And of course, we can pair it alongside some other powerful mitochondrial agents, whether it's, CoQ10 or PQQ for mitochondrial biogenesis, or things like MOTS-C, which is a very wonderful peptide that is associated with, we call it an exercise mimetic, meaning it sort of influences and potentiates the same cellular changes, positive cellular changes that we see when people exercise or when they fast, right? So the mechanism at play there is what we call AMPK, which really drives the translocation or the movement of a certain receptor. We call it the GLUT4 receptor from inside the cell into the membrane of a cell. And that GLUT4 receptor allows glucose to come into the cell from the bloodstream. And when we have more efficient glucose metabolism, of course, we're going to be ramping up these, pathways and these genes associated with improved health span and longevity. So now we're getting into some of the sirtuin genes that can be activated through AMPK activation and GLUT4 translocation, and MOTS-C does just that. So that's another powerhouse one. And I'm seeing a lot of, when we stack these peptides, whether it's the mitochondrial peptides with the GLP-1 receptor agonists, we are, able to really help people become much more metabolically efficient. And, that overall is just going to support their wellness and really dramatically reduce the risk for chronic disease, which is great.
Thank you for that. I've not heard of some of these peptides. So I'm so glad we went through though. The SS31 is new to me. So that, and I do know many people who still feel like they're suffering from long COVID. So that is very promising. I've heard of the BPC 157 because my son was diagnosed with ulcerative colitis when he was 11. He's been in remission for a long time. So I haven't had to try that one, but I've known about it. And there are a lot of alternative therapies that we haven't tried yet, which is good. It's you want to have as many things in your arsenal as you can. But going back to the peptides in general, so they're mainly just strings of protein, correct? In different orders.
Sure. Yeah.
Proteins. And I've seen specifically for BPC 157, you can get an injection of it, or I've seen as a practitioner, I have a full script account where people can go and order high grade supplements from it. I've seen there's a BPC 157 form there. What's the difference? Is one a lot more potent than the injection? And the reason why we're injecting them is because they're proteins, correct? And they'll get broken down by our stomach acid. We can't take a lot of them orally, just so people are understanding that correctly.
That's a very valid point. Yes. So BPC 157 is one of those interesting peptides that has a couple of different modes for delivery. So it can either be a subcutaneous injection into a little bit of a pinch of fat tissue on the abdomen or other place in the body. And when we inject BPC 157, we're getting a systemic benefit. We're getting, broad benefit throughout the body and a broad response throughout the body. It doesn't need to be site specific. We hear about that a lot of times in regards to some of the tissue healing properties that it has and its application for orthopedic or musculoskeletal injuries. But I love to administer BPC 157 as an oral agent if somebody is utilizing it for those gastrointestinal benefits. So generally 500 micrograms twice daily. And another one I forgot to mention earlier is lorazepam. Lorazepam, if you're familiar, this is basically came about as a peptide that was being investigated for its potential to help treat celiac sporosis. So what it does is basically helps to restore the tight junctions between cells of the intestines and the colon, where we can have leaky gut, right? Where, we have inflammation, which begets basically release of a molecule called zonulin, which is an immune protein that allows the immune system to come in and sample, things that are foreign to the body. If we think about the gastrointestinal tract, it's really, the number one interface with the outside environment outside of our skin in our body. And so, the immune system is constantly sampling things that we're putting into our body. And zonulin is very necessary for that sampling so that we can, recognize potential pathogens and form, antibodies against them. But if zonulin is constantly upregulated or activated, then it is going to make it so that those tight junctions in between the cells of our colon are constantly, pulled apart from each other, which allows bacterial products and waste products to filter out into the bloodstream, where they can, a lot of times they migrate to the heart and they can contribute to plaque development. And so we're, talking about bacterial endotoxins and lipopolysaccharides that are really potential bad players that we want to keep them where they should be and eliminate them appropriately. So lorazepam, long story short, helps to repair those tight junctions and bring the cells back to each other nice and firmly, so that we are dealing with much less of the leaky gut and the subsequent inflammatory cascade.
Very interesting. And a lot of times, people who are doing all the right things with their nutrition, they're exercising, they're sleeping, they feel like their stress is managed. Maybe they're even doing the circadian things. But they have things going on in the digestive tract, or those tight junctions are leaky and there's systemic inflammation going on. That's really hard to know when that is going on. And you said, like the elevated zonulin can be an indicator of that. But it's nice to know that there are things out there that can target all of these different areas, that it goes so much deeper than, oh, I just eat some processed food here and there. That's not helpful for our body.
Sure.
There are a lot of things that people aren't thinking about. So I'm glad that you're bringing those to light, and that there are some alternative therapies that people probably haven't heard of. So going back to the GLP-1 medications, I don't know if you want to call them peptides. There's so many of them. Like, I think it's like one in 5 people-ish are adults who suffer from some metabolic insufficiency are on some sort of GLP-1, whether it's a microdose or an injection, kind of depending on what their diagnosis are, what's covered by their insurance, and who's doing their care. But I think it's really important to go back to something you said about GLP-1, is that it's a receptor agonist. So we're not injecting the actual GLP-1 hormone that's primarily made in the large bowel. I know that there's some made in the brain as well, but can you talk about that a little bit more? Because I think it's really important, and one of those things that's just kind of glazed over when people are talking about GLP-1, like they think it's the actual hormone and it's the receptor agonist. And I'm sure some of them, there's so many that some of them act a little bit differently. I know some of them are acting on the enzyme that breaks down the GLP-1 hormone, because the GLP-1 hormone's half-life is very short. And so if we can, kind of extend that half-life a little bit and extend its activity, we'll talk about the natural things that can extend GLP-1 activity and why we've gotten into this mess in the first place. But if you could go over just kind of what those things are doing, because I think it's really important that people know it's not the same as the actual hormone that's produced in our body.
Right. Absolutely. Yeah. So GLP-1 receptor agonists, as you said, GLP-1 is a hormone that is produced naturally in our bodies by intestinal L cells, right? Which are, primarily, the focus here is, as you mentioned, the small intestine. And so when we're using these peptides, we're using, chains of amino acids or sequencing agents that basically activate the receptors to our body's, own GLP-1 hormone. It's not a totally foreign substance that we're working with here. And so that in and of itself, speaks to the safety of, GLP-1 medications used appropriately. But basically what they are is they have a multifaceted mechanism of action, and they are what we call incretin mimetics. So they contribute to a glucose-dependent release of insulin from the pancreas when GLP-1 is activated. And this allows us to more efficiently utilize the glucose that is, delivered via a meal or a snack. They also act to slow down the rate of gastric emptying a little bit. So, by this mechanism, we have a little bit more activation of some of the stretch receptors at the pyloric sphincter, where the stomach empties into the small intestine. This, in turn, will act on the hypothalamus to increase feelings of fullness earlier in a meal, or improve the level of satiety that we feel in between meals and snacks and so forth. And then the other aspect is that they work directly in the brain, the arcuate nucleus, which is an area of the hypothalamus, to actually cut down on the levels of what we call food noise, right? Cravings, that desire to just, walk around the kitchen and graze for, snacks and foods and whatnot. So, multimodal benefit and multimodal mechanism of action by which we can really see some metabolic improvements with GLP-1s. And, as you mentioned, there are definitely things that we can do to help improve the activity of GLP-1 and improve the natural response to GLP-1. A lot of that, I utilize certain fermented foods or recommend fermented foods, as well as certain probiotic strains in my practice. Your Akkermansias, your Bifidobacterium, Bacteroides, these are all powerful inducers of GLP-1, and butyrate, which is a byproduct of some of these bacterial strains, and the other short chain fatty acids, propionate acetate. These can all really help to activate GLP-1 in the body. And then, looking at like fermented foods and feeding those bacteria with resistant starches. All great options for really trying to improve, the performance of our microbiome and help to lower inflammation and improve insulin sensitivity and so forth.
Yeah. And when you look at what does increase GLP-1 and extend its function, it's eating protein, especially in the morning. It's eating fiber, like you said,
Yep.
and specifically soluble fiber. It's getting good restorative sleep and having strong circadian rhythms and going to bed early. And, managing stress is one of those things that's like, okay, that's easier said than done. And being active. So when you look at the last 50, 60 years, we were told not to eat eggs, not to eat meat. We have taken the fiber out of most of our food, and I hate to say it, but like 80% of the grocery store is crappy, toxic food with no fiber in it. And, we've swapped out convenience for good, healthy food. And people are, they're not outside as often, they're staying up, they're on bright screens. So it's just like, you could see why we've gotten into the predicament that we have, and why people are just benefiting from these peptides, medications, stacking them, all the things that you said. But one thing that I found to be super helpful and is studied by Dr. Ben Bickman, and, I'm sure you've heard of him. If you work in insulin resistance, you know of Dr. Bickman. But he's behind the Feel Great system, and that is the 2-step yerba mate, the concentrated yerba mate, and the soluble fiber matrix. Like you said, it just helps to increase all of those bacteria that are insufficient, and people do really well on it because it's just bringing GLP-1 up. It's increasing the fiber. It's really crazy. It's a really crazy.
Absolutely.
Yeah. So I'm glad that I've finally discovered that.
And talk about a delicious, beverage too, if you drink it in tea or so I'm a big fan. Absolutely.
Do you use the system yourself?
So I like yerba mate. I, try to incorporate as much fiber as possible into my diet. I always am recommending at least 30 grams of fiber a day, but if somebody can target even more, 45, it's hard to do that. But, then I guess the combination of things is sort of, hitting on that system. But yeah, absolutely.
Yeah,
Absolutely.
for sure.
2 powerhouses there.
Yeah. Yes. And I started it in July, and I'm pretty dang healthy. And I was like, oh my gosh, I can't believe how much benefit this has. So I have a lot of people utilizing it just because it does all of the things that we've been talking about. But Yeah, it's an amazing thing. And once I learned Dr. Bickman was behind it, I'm like, okay, I'm in. Like I'll at least give it a try. And if it, it doesn't help, it doesn't help. But then I was like, okay, this stuff is really crazy. And I will say, like the soluble fiber, there's five or six different soluble fibers. I think
Mhm,
I've
mhm.
been deficient on a lot of those types of bacteria for a long time, because if I ate like lentils and a lot of beans, I would get super bloated. I'm like, oh,
Yes.
my digestion. And with the balance portion of it, just working my way up, that's like it's increased the bacteria that are necessary for the breakdown of those. And I know it works on butyrate as well, which is always a game changer in the bowel. So
Got it. You got it. Yeah. It's always hard for me to reconcile the potential downsides of, beans and legumes and things because I love them. I love the taste. I love the texture. Eating them can really like round out a meal, but the lectin, phytates and whatnot can they can really inhibit some nutrient absorption and disrupt the integrity of the gut lining for several people. And it's the type of thing that it bothers me because I want to be able to enjoy a lot of these foods that I'm often seeing as potentially problematic for people. And just got to play it by ear, really, and see how people do.
I know everybody is so different. Like I've had trouble with bloating since college, and I've tried a lot of different things. The system has really been helpful because it's helped to increase the bacteria and change the bacteria. But my husband's one of those people who whatever he eats doesn't matter, like just doesn't bother him. Like I'm always like, oh, I'm bloated again. And he like looks at me like he doesn't even realize, like, what does that even mean? So
Yeah, sounds like my wife and I.
it's
She
so
has
individual.
Yeah, she's very responsive and reactive to food. I sort of don't have any issues. Like for the most part, I can eat a lot of different things, and I don't tend to have overt reactivity to them. Of course, I try and be regimented and relatively strict about my approach to nutrition. But she is constantly dealing with bowel issues, and it makes me you know, it drives me nuts because like I want to be able to help her. This is what I do. And it just comes down to the fact that she's a little bit less regimented with her approach. And you gotta be consistent. You gotta if there's something that you're sensitive to, you have an allergy to, you gotta avoid it no matter how much you like that food. Physical pain is not worth a little bit of mouth pleasure, of certain types of foods. So, you
Yeah.
know,
Yeah. I've been gluten-free since 2016 because I'm like, it's just not worth it. Like it's not worth it for me to have, to be in pain and to feel, I just feel off. Like if
sure.
30 seconds of eating something with gluten in it. So yes, and I think for women, I mean, not all women, definitely there are lots of men with digestive issues as well, but women with their hormones and cycling and going up and down. And I know for me, like I'm very touchy with cortisol and I have to be really careful. And if my cortisol is high, of course, I'm not going to digest food very well. So there's just a lot of factors that go into digestion for sure. Um,
Certainly.
what other things besides that we haven't talked about? What going back to mitochondrial function, you said you're really kind of
Mhm.
honing in on that, which is very smart as a practitioner, because if you can optimize people's mitochondrial function, their whole health system is going to benefit. Insulin resistance is going to get better. What other things are you recommending that we haven't talked about? That people can do at their homes and maybe for free and not have to see a specialist for.
Sure. I think one of the major areas that we are contending with on a population level now is sleep disruption and poor sleep. And, I always tell my patients there's a few core elements to wellness, right? It's how are we sleeping? How are we moving our bodies and exercising? And what's our approach and our relationship with food and nutrition? But sleep is a critical component of that, right? Sleep, we think of the daytime, nighttime cycle as being, anabolic during the nighttime, right? We're repairing, we're rebuilding our tissues that we're then breaking down for the purposes of energy generation during the day. And so, nighttime has to have, we got to be getting at least, 7 to 9 hours of consistent quality sleep. When we don't, we find that we're getting ourselves into a much more pro-inflammatory state. We're starting to kick out more of the bad players, those molecules and cytokines that really do induce inflammation. They disrupt cortisol. So, we have the need to maintain sleep habits and sleep hygiene so that our mitochondrial function is optimal, and repair tissues. And poor sleep is going to drive spikes in cortisol that are going to make us more insulin resistant. Even just one bad night of sleep is enough to really sort of induce some of these inflammatory changes. And conversely, one good nap, even a short 20 to 30-minute nap can help to restore some of that anti-inflammatory potential in the body. And, we think about sleep as like a time to also clear the brain of those metabolic waste products of normal neuronal activity, lymphatic drainage and whatnot. So always, doing things that can help with that diurnal pattern of cortisol release. So waking up at the same time of day every morning, getting our feet on the ground within the first 10 to 15 minutes, outside, getting some morning sun exposure if the day is nice, keeping our physical activity in the earlier part of the day if we can, so that we're avoiding some of the pitfalls of having that dopamine and cortisol spike. Limiting caffeine. I always say caffeine, we need to cut it out after 1 p.m. if you're a caffeine drinker, because it's got a long half-life. So if we're drinking caffeine into the latter portion of the day, we're really going to be up and activated. And then doing things like the breath work and the meditation, even a long, or it doesn't have to be long, but a hot shower within 30 to 40 minutes of bedtime. The rapid cooling can induce drowsiness and calm. So all those are all the lifestyle things. And then of course there's supplements to help with sleep. And what we really want is the deep sleep, the delta wave, slow wave sleep to be augmented. This is when we have our most robust growth hormone pulse, which is necessary for that tissue repair that we were talking about. And so there's things that we can do to help with that as well. But sleep is just, it's critical. We can't ignore it. And it becomes so hard nowadays because we're on our phones. We've got a TV show that we're watching close to bedtime. And it's just, we got to make the concerted effort to stop these behaviors if we want to ensure, optimal health.
Mm-hmm. I notice such a difference if I have to be out and about after, like I like to start winding down by 8 for sure, put my blue light blocking glasses on and just be reading and not watching TV if at all possible. And man, when I have to, like my son plays volleyball, when I have to sit in a gym late, I'm like dying. I'm like, I just want, like, you feel like a total like I feel like a grandma, but I'm like, oh, I just want to like block this bright light and get out of this crazy gym and all this noise. And once you're used to that nice wind down routine and your sleep, really, really is benefit. And especially women my age, perimenopause and menopause. I mean, our sleep is just, oh, it can be so touch and go depending on what our hormones are doing too. But do you use red light therapy at all for mitochondrial function? I know for me, I just like to go outside whenever possible and get sun exposure, but I know that generates some of that mitochondrial water and the hydration within the cell to make our cells function more appropriately and to optimize it. And so something as simple as sitting outside for 5 or 10 minutes with skin exposed, if possible. It's not actually, red light penetrates some clothes, but Yeah, and then in the winter, like I'm in Wisconsin, so I can't really sit outside. In the winter,
Right.
I do have like a little red light that I use. It's a
Yeah, red light therapy can absolutely be instrumental. Here at Remedy Functional Health, we offer EBO2 sessions, which is extracorporeal blood ozonation or blood oxygenation and ozonation. And essentially, in a 45 to 60-minute session, we're pulling the equivalents of 4 to 6 liters of blood. We're filtering it through a dialysate mechanism where we are able to remove mold, mycotoxins, and heavy metals, and micro nanoplastics, and other immune complexes and such. And then we're also able to run it through some light filters, red light therapy being one of those, or red light filters being one of those. And yeah, absolutely. The whole purpose is the mitochondrial enhancement. And this is it doesn't have to be so invasive. I mean, 15, 20 minutes in front of some red light therapy lamps can be absolutely beneficial. And couple those things with a little bit of cold exposure, the grounding that we've talked about, getting your feet on the ground, helping with ion transfer. There's intermittent fasting, right? High intensity interval training. All of these things can really help to improve our overall mitochondrial performance and energy metabolism.
Yeah, and I know for me, being at a northern latitude, and I've lived in Wisconsin my entire life, there's always just dread of winter coming. Like, oh, here it comes. I'm not going to be able to go outside. And like I've always been a person who just dresses for the weather and goes outside, but it gets challenging. So now that I've learned these things about red light therapy, and not wearing sunglasses all the time, and letting the natural light filters go into my brain, tell my body what time it is, what to do, like really just embracing the cold and the dark rather than fighting it. I've like the last 2 winters have been a lot different. So
Excellent.
I have just a couple audience questions, because I like to pull people or pull my audience when I have somebody coming on, and then
Sure.
you're out of here. But one is just, you're just talking about intermittent fasting. So I was like, oh, good. This was a question, because I've been teaching intermittent fasting for years, but we definitely, like, I got myself into trouble with fasting all morning for years on end. So I've had to change my approach and do more of my fasting in the late afternoon and evening. That works much better. I don't even feel like I'm fasting. But what are your thoughts on fasting for women in perimenopause or menopause, or with thyroid issues? Like, this is a hot topic, it's very controversial. Like, people like to say it doesn't affect your thyroid at all. It doesn't affect your cortisol, but I've seen it firsthand. But what would you say to that?
In right doses, it can be very effective. Just with anything, we talk about things in moderation. Well, intermittent fasting will absolutely improve the efficacy of certain cellular pathways that are involved in longevity and health span. But it can't be in excess, right? So specifically with regard to metabolic function, if somebody's consistently not hitting their caloric threshold, and intermittent fasting sort of supports a caloric deficit, right? That's in part how it works. It's not only time restricted eating, but for a lot of people, especially if they're utilizing something like a GLP-1, they're generally eating less when they're doing intermittent fasting. And so somebody who is constantly not hitting their basal metabolic rate caloric threshold, they're going to be in a catabolic state. They're going to start breaking down proteins, utilizing those amino acids for energy, and that will ultimately lower their basal metabolic rate even further. So major, risk there if done in excess or incorrectly. So that's one thing. Another thing, again, sort of in the same vein, if you want to crash your thyroid, that is basically the way to crash your thyroid, right? And so what happens is, by way of impaired nutrient absorption or nutrient deficiencies, you're going to have impaired conversion of T4 thyroxine into T3. And, that is one way. You're also going to drive up a molecule called reverse T3, which is the metabolic brake when we associate that with thyroid. And basically it just blocks the receptors of the thyroid to your thyroid hormone. And crash dieting and things that contribute to inflammation is one of the major drivers of elevated reverse T3 levels. And if somebody's dealing with that, they're going to have major issues. From the standpoint of cortisol regulation, ultimately, if somebody's in a caloric deficit persistently, then that's a stress state, and the body, the adrenal glands are going to respond to that, and we're going to have cortisol dysregulation as a result of that. So intermittent fasting, a few times a week, making sure that we're hitting our caloric thresholds, can be instrumental and largely beneficial, but it's got to be done right. We always have to, have the opportunity to, trick the body, fool the brain, make sure that we're not, the body's not perceiving a starvation state, right? If we get to that point, we're well beyond where this is beneficial. So love intermittent fasting, think that it has huge benefits for not only insulin sensitivity and autophagy, the cellular repair process, and mitophagy, the mitochondrial repair processes, but just has to be done right. And there's plenty of different methods out there, whether it's a few days, 3 to 4 days a week where you're doing 16/8, or a day a week where you're doing a full 24-hour fast. Maybe once a month, once every few months. For the people that are really into it, they might do a 72-hour fast to just, and the benefits of that are far reaching. Again, the autophagy and cellular repair and cleanup, but also, things like stem cell migration to areas where we really have damaged tissue, and uncovering senescent or zombie cells that are just very inflammatory and not really doing us any good. So I love intermittent fasting, got to be done right. And
we don't want to take it to extremes. We don't want our leptin hormone to get crabby at us. And if we're cold all the time and we have high morning blood sugars when we haven't eaten 18 to 20 hours, we might need to change things up a little bit.
Exactly.
Last question, and then tell us how people can work with you and where you're at if you see people remotely. But
Sure.
we already touched on this one, so maybe just if there's anything that we didn't hit that we've already talked about, but I think it's an important question. How do I know if my gut health is contributing to my blood sugar swings? Because again, we've talked about a lot of this, but sometimes we get these blood sugars that are just like, I don't know what I'm doing. Like I'm ketogenic, or I'm following low carb, or maybe they've been doing that for too long. But how do we know when gut health's coming into play?
Yeah. So it's striking sometimes when I see patients that, phenotypically from the outside, they look lean, they look healthy. But then I get their lab work back and it's like, oh my God, what's happening here? This person is insulin resistant. They're very inflamed, and that's what it comes down to, right? So if you are ultimately if you are the foods you're eating, namely, are contributing to sensitivity patterns and chronic inflammatory changes within the gastrointestinal tract, then ultimately, the downstream negative effect is that it's going to impair insulin sensitivity in the body. Inflammation and insulin resistance, they go hand in hand, and it's a cycle. It's, a circle that one is going to beget the other, and that's going to precipitate the other. So I recommend very much, if somebody is symptomatic, they're having IBS type issues, they're having bloating, gas pains, they just generally feel like they're suffering from brain fog or joint ache and muscle ache, fatigue, headaches. try an elimination diet at a baseline, try an elimination diet, cut out gluten, corn, soy, dairy, and eggs for an initial 4-week period, slowly start to reintegrate those. If you want to be even more aggressive, you can follow a full autoimmune compliant diet. That's sort of at a minimum. If you want to be more aggressive, you can do, skin testing for food allergies. They now offer some great serum tests that look into IgE and IgG mediated food sensitivities and allergies. So that's a relatively accessible test that can be done, in practices like mine, where you can really get a good idea of what you may be reactive to, and then start to eliminate those things and see how you feel, see how your blood sugar responds.
Very
Continuous
good.
blood glucose monitoring is always for somebody who has the ability to access those devices.
I know. I wish they were available to it's coming over the counter soon. I think we're getting close. They're available over the counter in a lot of European countries. So we always just lag behind. But where can we find you? Where can people find you? Can we do you work with people virtually?
Yes.
Yeah.
Yep.
Good.
So my website is www.remedyfunctionalhealth.net. On Instagram, we are remedy.functional.health. You can follow us on there. I post a lot of content on there. In Maryland, I am licensed in Maryland, so I work with clients throughout the state of Maryland via telehealth platform. So if you're in Maryland, I'd be happy to touch base with you. We can do everything remote. It's always great to have you in the office because we offer a number of different assessments and testing options here: body composition analyses, PNOE, metabolic breath analysis, all sorts of things that can be very useful to you in your health journey. But happy to work with people remotely. And then, of course, locally here, if anybody wants to stop into the office, just give us a call. Our number is 443-342-4141. And anywhere else in the country, if anybody has, some interest in any of the topics that we reviewed, I'm happy to engage, just over telehealth or email or, Instagram, that sort of thing. So.
Sure. Excellent. Well, we'll put that all in the show notes. And I know I've learned a lot today, so everybody else had to have learned a lot too. So thanks so much for coming on. You're a wonderful guest.
Awesome.
We learned a ton, and we certainly appreciate your time and the work that you're doing in the field.
Thank you so much, Shana. I really appreciate it. You have a great day.
You too.